In our first episode, we explored the underlying roots of insurance, which is community. We also discussed the ideological foundation of insurance, which is to love your neighbor as you would love yourself. But more importantly, why modern insurance in the United States often fails to live up to this ideological standard. In this episode, I'm going to share with you the two things we need to begin fixing healthcare and insurance in America. They're actually pretty simple. The first is insurance literacy. Most specifically, when it comes to our healthcare, who's paying for it? Now, I can take care of this in about 10 minutes, and I plan to do so in a future podcast episode. It's as simple as explaining why we pay premiums when it comes to insurance, how they work, and why it matters. Once people understand basic insurance literacy and how the system is designed to all but guarantee we're paying for everything, the second thing we need to know is how much we're paying. But this can't just be a dollar amount. This price has to be presented in a meaningful way so that anybody can both understand and assess its overall value. A simple solution that could probably be implemented in less than 30 days here in America is to include the price Medicare pays for the service, along with a percentage of Medicare on your explanation of benefits. Now, before I explain what that means, it's important to understand what Medicare is. Medicare is a government-based insurance program that covers over 65 million Americans. 1 in 5 Americans, mostly people over 65, pay for their healthcare through this government program. Now, it's important to note that Medicare is not free. It's not a handout. Medicare is paid through a Medicare tax that's assessed during your working years for you and your spouse. When it comes to Medicare, the government sets payments, and it's accepted by roughly 98% of healthcare providers. So now that we know what Medicare is, let me give you a real-world example of how this would work. Let's say Medicare pays $10 for a comprehensive metabolic panel, a price which is accepted by almost all providers. My wife had the same test done at a local hospital outpatient department, and they billed her $845. What I'm proposing is we add what Medicare would pay, along with the percentage of Medicare to her explanation of benefits from the insurance company. In this case, her EOB would clearly state that Medicare pays $10 for the exact same treatment, and that her cost is 8,350% more than what Medicare would pay. To put this in perspective, this would be the equivalent of a fast food restaurant charging $676 for an $8 combo meal, or a grocery store charging you $253 for a $3 gallon of milk. I'm going to go out on a limb here and say if a business did this to you, you would fight it. You would tell everyone you can, and you would never do business with them again. And that's the point. Now, I'm not suggesting that everyone should pay Medicare rates. That would be absurd and most likely collapse the system. What I'm suggesting is Medicare be the foundation for determining a fair price in a free and fair market. So when patients see prices that are 500, 1,000, even 10,000% of Medicare, when people start realizing how much more they're paying, change is inevitable. Imagine the impact this would have if everyone started posting these outrageous bills on social media, and they reached out to their local news, and they demanded answers from their politicians. And just to be clear, this isn't political. This isn't about socialism versus capitalism, Republican versus Democrat. This is about right and wrong. This is about being a decent human. It's about doing things because they're right, not because you can line your pockets at everyone else's expense. More importantly, once people realize we're all paying for this, not the insurance company, and how much it really costs, the apathy that has been preventing any real change in healthcare and insurance goes away. The lack of interest, enthusiasm, or concern about what we pay for healthcare disappears in an instant because people would quickly realize it's not everyone else's problem, it's your problem because it's your money. And if insurance companies were truly on board with saving us money, and it isn't only about profit, they would advocate for this. If doctors, hospitals, pharmaceutical companies are concerned with keeping us healthy and giving us the care we need in an affordable way, they would advocate for this. Brokers, agents, consultants who say they got into this business because they want to help people, they would advocate for this. All the politicians who claim they want to fix a broken healthcare and insurance system should be on board too. It's a simple fix and it can save a fortune. Now I'm going to go out on a limb and say that most people who benefit from this broken system won't be on board. I hope I'm wrong, but if I'm not, we need to demand change. When we do, you'll see who's in this business to do the right thing. You'll also see who's in this business to profit off of people's pain and suffering. And once we see who supports this common sense change, we should support them. The best way to do that is to vote with our dollar. Reward the people that are doing right by you, your family, and our community. Punish the people who are a cancer within our system, because that's how free markets work. As a community, we have some work to do. If we want to take back control of our health and finances, we need to increase insurance literacy and revise our current price transparency laws. We can't keep doing the same thing, expecting a different result. We owe it to ourselves, our families, and our businesses. We also owe it to all those frontline healthcare workers who are tasked to keep us healthy, but are often overworked and underpaid in our current system. If you agree, please consider financially supporting us as we teach and hopefully inspire the masses. We put a link in the description of this podcast. Even a small donation, just a few dollars, can go a long way to help us create and distribute this information. And to help you, help us, I've put together a resource that even if you have insurance, can give you access to high-quality, low-cost healthcare that can save you a fortune. Here's a sample of what I included. Local healthcare providers with upfront pricing. Unlimited virtual pediatrics for all of your kids for as little as $18 a month. Low-cost surgery options. Financial assistance. Low-cost and in some cases, no-cost prescriptions. For instance, a common medication that treats MS costs between $2,000 and $14,000 a month through GoodRx. You can get that same medication through Mark Cuban's Cost Plus Drugs for just $93 a month. Having access to just one of these resources can absolutely change somebody's life, both physically and financially. I included a company that offers over 100 common labs under $7. That lab my wife was billed $845 for is just $7.84 through this resource. They have x-rays starting at $23, mammograms starting at $125, MRIs starting at just $250. To put this in perspective, I see people paying $1,500, $2,000, even $3,000 for the exact same MRI. And they do this for no other reason than they ran it through insurance. And if they're on a high deductible health plan, they likely pay 100% of that cost. If it's a copay plan, they're pushing that extra cost back on the community, only for the insurance company to raise their rates next year because they're spending too much. This is why the community movement is so important, because at the end of the day, we're paying for it one way or another. We're all in this together. I hope you'll consider a small donation, and if you could share this resource and podcast with your greater community, please know your support is greatly appreciated. And we'll continue this good fight in the next episode.